Mommytrack Daddy Whispers Podcast is now called Birth Agni Podcast.
Here's a question for you. When did you conceive? Yes. When did you conceive? Hey, hi, welcome to Mommytrack Daddy Whispers Podcast, BITESIZE-Pregnancy Series, the aim of which is to provide you a lot of information so that you are able to make informed decisions throughout pregnancy and childbirth. My name is Divya, and today we are going to discuss how are due dates calculated, what is their significance, and what happens when you go past your due date. अब इन सवालों का जवाब देने के लिए कुछ और सवालों के जवाब ढूंढने पड़ेंगे. To answer this, we have to ask a few more questions. What really is a conception? That is, how do you conceive? What is the gestational age of the baby? So we'll figure the answer out for these questions to know better how are due dates calculated and what is their significance. Conception. Conception really is the fertilization of egg with a sperm. That is the marriage of a bride with a potential super excited groom. You'd say, Bus, I knew it. Of course you do. And if you've been trying to conceive, you may not actually be able to time when exactly did you conceive, right? You might say, okay then. Okay, maybe that day or the other day or the day before maybe, right? So it's tough. It's tough to pinpoint when exactly did you conceive if you were trying for it. The thing to note here is there are a number of combinations that can happen here. 1. What if you ovulated after you had an intercourse? So the sperm from your vagina will enter your uterus and reside in the fallopian tube. What is a fallopian tube? A fallopian tube is a tube that connects your uterus to your ovaries, right? So it can eagerly wait for up to 3 days. And woohoo, when the egg arrives, it finds the one and fertilization happens and you conceive. The second combination can be, what if you ovulated before you had an intercourse? So the egg remains in the fallopian tube and waits for that one fine groom to come. It can be in your fallopian tube for up to 24 hours, waiting for that one fine sperm. And woohoo, when it finds that one, the fertilization happens and you conceive. So it really is difficult to know exactly when did you conceive. And you never know if your mind sneaks into your conversations and tells the egg, stay a little longer, the sperm is on its way. Or tells the sperm, stay a little longer, the egg is on its way. अभी ठहरो आते ही होंगे. अगर आपकी कॉन्वर्सेशंस में आपका माइंड स्नीक कर रहा है, it may want to support the pregnancy in your life and it may want that happen. It may prolong that period. So all of this is an approximation. So you'd never know when you conceive, body and its mysterious ways. So science is based on approximation, and that is why we need due dates, because we do not know when did we conceive. Now, due dates are an approximation on that very question. When did you conceive? So the doctors use a formula. They ask you the first date of your last periods. And remember, they don't ask the last date of your last menstrual periods. They're going to ask the first date of your last menstrual periods. They'll add 9 months to it and then additionally add 7 more days. So that becomes your term, the age of your pregnancy. Now they have an approximate date by when you will be in healthy labor. But remember, it's important to know that this is also an approximation. So you could have conceived on any of these days, and due to a number of combinations which we discussed earlier. So what does it mean for you? Why do we calculate due dates? Let's talk about gestational age a bit and come to that. You must have heard about gestational age. It tells you how far along in your pregnancy you are. That is, what is the age of the baby in layman terms? What is the age of your pregnancy? Now, this is calculated based on the baby's health and a number of parameters. An ultrasound is done to figure out the baby's measurements, and based on that, a gestational age is calculated. The idea here is to assess when you conceived and know when the pregnancy will be full term. Your doctor may correct your due date based on the gestational age or may keep gestational age throughout in consideration if the doctor does not change your due date. Again, gestational age is also an approximation. Nobody can tell when you conceived. It's all a guess. Overall, the due date is an idea of your full term. It is an approximation. And hence you may go into labor before or even after your due date. And it is normal. Why calculate the due date then? It is important. It is very, very significant to know that your pregnancy is healthy throughout. Post due date, your doctor would be extra cautious to catch problems in time and help you deliver a healthy baby. So doctors need to know when the alarms should be raised, right? I would say it is a kind of threshold for you. So what happens when you go past the due date? Doctors would generally increase your examination. They would assess you time and again. They may wait for at least up to 42 weeks for you to go into labor naturally. And based on their practice, they may wait more. They may examine you regularly. And if you and your child are responding well, they may, let you wait a little longer. They may give you a list of emergency situations to note and notify them whenever, if in case you undergo any of them, just to be cautious. As long as you and your baby are doing fine, doctors may wait and avoid inducing you. However, if they sense the risks, if they sense that the risks are high now, they may not wait and they may tell you that this is the time that we should induce you. Now, there are a number of methods that can be tried to induce you. And these methods can be discussed with your doctor. By methods, I mean methods other than medication to induce labor. A number of methods can be used to put you into labor, and this is another part of informed decision making, asking the right questions. So you should definitely ask your care provider, can you yourself trigger labor? Can you do something when you are post your due date to trigger labor? Can they help you start labor by other means without the medicines, that is? Know your options, ask your options, and choose what you can opt for. Now, why some women go into labor post-term, right? Now, nobody knows why some women go into labor post-date. One of the major things that we can pinpoint throughout our conversations, all that we understood through this conversation, is that the due date is actually an approximation. So your baby is developing. Your baby may want to develop a little more. You may not be ready for being a mother yet. So your brain is a big part of everything that is happening to you in pregnancy. So nobody knows, right? We'll talk about what triggers labor in the next episode based on the evidences that we have so far. But nobody knows what triggers labor on an accurate level, on a precise level, what triggers labor. Nobody knows that. So there are a number of factors that trigger labor, and a lot of them are on the evidences. Nobody actually knows what triggers labor. So we will discuss what triggers labor based on the evidences in the next episode. Wrapping up, so this was all about how due dates are calculated, what are their significance, what can happen, what questions should you ask when you go post-date. And again, knowing, relaxing, being calm, that there's nothing to worry about if you're post-date. You should know your options. You need to relax and be calm. Probably your baby is not ready. You never know when you conceived. So your post the due date is actually an approximation. So you should relax and let the body do its work. So in the last episode, we talked about some common pregnancy symptoms and the reasons behind it. If you've not heard it yet, please do. In the next episode, we shall touch upon what triggers labor, what is the role of fathers in pregnancy. Leaving with this info and a note. Do not worry about your due date, like I said. Your mind is a powerful thing. You never know you're going to labor when you feel it is time, right? If you feel it's time, you never know, something gets triggered and you get into labor. So hang on to your intuitions. Trust your intuitions, all you lovely mamas out there. If you like listening to us, please follow and leave a review if you have an option on your podcasting app. Let a friend know who may benefit out of this episode and this entire series. Let us know if you wish we come up with a specific topic you want to know right now in your pregnancy journey. Write to us how you feel about this series, how you feel about this podcast. You can write to me at Mommytrack Daddy Whispers @gmail.com. We shall await your responses. Till then, keep listening and remember, you got the power. Stay tuned. Keep listening.